finally, a source of raw, real, and honest information on healthcare issues that matter most. Welcome to BS Free MD. From the latest medical information to how to stay sane as a doctor or a patient, no subject is taboo, and no BS is allowed. Now, let's welcome your hosts, Doctors May and Tim Hindmarsh.
Okay, we're going. We're actively podcasting right now, which is amazing because when this is released, it will be a week and a day. So 8 days after May's surgery. And she's back in the studio, but we're recording this and it's literally 6 days after the surgery. And she's able to leave the house and sit in a chair and speak into a mic. And I'm like, okay, well, it's time to start doing the dishes and making me some food.
The miracles of modern science, right? And for the two people that watch us on Rumble, they see I got cleaned up. I actually took off my Roots sweats and sweatshirts. I washed my hair, kind of fixed it a little bit, and I don't look like a witches of Eastwick, a horror site.
Bo.
As I've been posting on our social media. So if you're on Instagram and Facebook, I've been posting kind of just daily updates on how things have been going, just for fun, and my partner in crime here helping me out, as well as my little rehab partner, the cat, who seems to, require more.
Well,
what should I say? He's much more of a diva than I.
The cat requires a fair amount of effort because, for whatever reason, he goes and sits in debris. He finds a debris field in our yard, and then he rolls in it, and he comes in, and he's got long hair, and he's completely coated in crap.
He actually, he comes in because he's got super long gray fluffy hair. He looks like one of those alpaca, not blankets, pillows, and we call him Fluff because he's fluffy, and he's filled. Every little crack of all his fur is filled with dirt and bark dust, and he walks around and sheds it like Pigpen, and it is disgusting. But anyway, he likes all things soft and fluffy himself, which means if I'm laying on the couch with a nice blanket on, he makes it a priority to be wherever it's the most comfortable, and all people must move around him. He's there. So
correct. So today we're going to talk about what went on last week. A little bit about hip replacements, how they work, recovery, when you should get one, etc. Surgery has actually changed a lot since we were in medical school, where basically the only people that got hip replacements were people that were 85 years old.
That's saying a lot. That was a long time ago.
Well, it's 30 years
when
ago.
It was like putting in a post hole in your backyard.
31 years ago. Yeah. So it's changed a lot. And it makes sense. Doing younger folks, et cetera, because the functionality of these is it really is one of the places in medicine where medical technology has really made a massive difference and helped people out a ton.
Yeah. So while I'm not an orthopedic surgeon, nor have I ever been one, although I have assisted in the OR, I'm going to give you a little bit of information about hip replacements, ways to avoid them, why you would get one, things to watch for, and then a little bit about how things have even changed for me from my first one in 2016 to now, things to be wary of, and all that good stuff. But before we get going on the whole May as a patient story, a word from our sponsor, which is brought to you by Tim.
Oh yes.
I'm hitting the tennis ball your direction.
Yes. So I can't even remember my own rhyme.
Gosh.
So
you made up a limerick and now I can't remember.
No, it's not a limerick. It's Oregon Valley Farm. They've been just outstanding. We eat a tremendous amount of their products. Pasture raised, antibiotic and hormone free.
Yes.
Beef, chicken, and pork.
And we're always playing up the beef. We eat a lot of beef, but honestly, and we talk about how good the chicken tastes, but the pork products, I guess we don't promote and push that enough. I'm not a pork person. I really don't like that. Tim loves pork chops and schnitzel and all things pork. We had cooked some a while ago. Man, the pork chops were so good. They didn't taste porky, if that's a word. They they were so tender and really weren't overpowered. I don't know, some pork chops that I feel like it's just gross.
Well,
disgusting.
The problem with pigs is they will eat anything.
Yeah.
The problem with industrial raised pigs is they get fed everything.
Yeah, I saw a post about that. I think I talked about it before. It was disgusting. It was like a garbage dump, and that totally got ground up into sawdusty material. It included the garbage bags, your Tide Pod boxes, and the whole 9 yards, and they fed it to the pigs. And imagine they're not joking when they say that you're eating all that microplastics per year. So
yeah, but the fact that pigs can turn microplastics into bacon is pretty. It's like magic. It's like the pig is the magic animal.
Well, Oregon Valley farm pigs don't do that. So if you want your microplastics,
I think they're fed caviar, aren't they?
I don't know. Maybe we'll have to go to that farm and check it out and do a little video.
Yes, we should.
So OregonValleyFarm.com online, the Parkers are the owners, and they outsource the meat from various farms in the Pacific Northwest, shipped directly to your door if you live in the western states area. I think it goes pretty far over west, including Arizona. I know they don't ship as far as Texas, but they do ship quite far across the U.S. towards the middle of the country, directly to your door. The shipping fees are really not that much at all. I don't want to talk too quickly and say what it is, but I think it topped out at $20 for if you had an order over $150. So it's really reasonable. It'll come frozen, or if you live local, you can pick it up in Albany, Oregon. Go online. They're having specials all the time. You can do an eighth of a beef, or you can just pick your pork chops and bacon, or you can get chicken, or a combination of all kinds of stuff. And on their social media pages, which is on Instagram on a regular basis, they have great recipes and ideas that they post. And anyway, I can't say enough about eating quality food that goes in your body, because you have one body, one life. You might as well fill it with good stuff.
Yeah, either that or try to turn microplastics into bacon. Either way, you come out a winner. All right, so what are we talking about today?
All righty, we're talking about hip surgery. Woohoo! Well, so anyway, I thought first, before we start going into like why, who gets hip surgery, and a little background reading that I did, the most common thing I get asked all the time when I tell people that I've had a hip replacement already, and then I'm getting another one, is, oh my gosh, I can't believe it. You're so young. You're too young for a hip replacement. I mean, that's the most common thing I think that I hear is, or what happened. So yes, being 50 was my 50th birthday present. Thank you very much for the titanium. And what can happen to a lot of people is that there can be various conditions that can occur that predispose you to having abnormality of your hips. Obviously, trauma and injuries. Osteoarthritis can occur in younger people. So commonly we think of people, and even when you said, like what you said, we went to medical school, most people didn't get hip replacement till they were at least late 60s, 70s, and 80s, because the joints didn't last that long, the replacements. And so they put it off as long as possible. People are in excruciating pain, which we'll get into why they're doing them earlier and in younger patients. But as far as
the orthopedic surgeon needs a new boat.
So yeah, that's part of it too. There's a lot of financial incentive for sure. But a lot of people, you just probably didn't know it, a lot of people would have had degenerative hip disease at a young age from various conditions. Myself, being all transparent here, no one's 100% sure. I have autoimmune conditions. I have polychondritis, which is an inflammatory condition of the cartilage, mostly the ear, nose, trachea. But it can cause inflammation of the cartilage elsewhere and osteoarthritis early. There's some thought that I might have a lupus as well, or mixed connective tissue disease. But the other thing that I'm thinking, and what I was researching, is that there's some congenital conditions that can occur. That might have been a factor for me. So, for instance, in some people, when your hip's developing and you think of the ball and socket, the hip, the femur is around head, and then it's up against your actual hip, the socket itself. When that grows and develops, some people, it doesn't form or it's not engineered perfectly so that the edges of the hip round out nicely so that it creates this perfect pocket. It could be a little bit shorter than it should be. It could be lipped a little bit. And then what happens with time, especially if someone's active, the bone, we all know what bone spurs are, basically from tendons pulling on things, bone spurs can start to develop on the edge, and you get more narrowing, and then the joint narrows, setting you up to tear the cartilage in there. So you can have a congenital condition that really doesn't cause problems as a kid, but it's just not a perfect hip. And then as you get older, if you're active and doing things, it starts to cause problems, cartilage tears, etc. There are congenital hip conditions like dysplasia. You've heard of some kids who need to wear special braces when they're young because their hips aren't formed correctly.
Like Forrest Gump?
I don't know. Did Forrest Gump have that?
I don't know. He had those braces, though.
I thought he had club foot.
No, I don't know if it was his hips or his knees. I don't think it's well defined in Forrest Gump.
Well, maybe you can look that up. But anyway,
Jenny, I got hip dysplasia, Jenny.
So there's that type.
My hips are like a box of chocolates.
The type I'm kind of
I ping pong.
Oh my gosh.
And Bubba Shrimp. Jenny,
are you done?
No.
So the type I was talking about for possibly myself is what's called femoroacetabular impingement. It's when that extra bone's growing along the edge, it shouldn't be there, makes it irregular. And then
I thought extra bone was a good thing.
Yeah, well.
Oh, that's different. I'm sorry.
That's right. You got me all distracted.
Just like extra chromosomes, not so much a thing that you actually kind of want, right? You want the right number.
Exactly.
Don't want the bonus.
Sometimes extra, not such a good thing.
Sometimes more is just more. It's not better.
That's right. And so trauma and injury. So if you're doing high impact activities, I always think of those downhill skiers tumbling down the mountain in a crash. You're stretching the joint, ripping the cartilage. So that sets you up for problems. People have other conditions where there's antibiotics, or I shouldn't say antibiotics, but medications that you can take that block the blood flow to the hip joint. And then you get things called avascular necrosis that can also occur for various reasons.
That's what Bo Jackson got.
Yeah. And then
Bo Jackson had a little tiny fracture in his hip from basically wiggling underneath a tackle when he was being tackled. And it caused AVN of his hip because he disturbed the joint enough that and hips are notoriously terrible with regards to blood flow. They don't have blood flow, which doesn't make a lot of sense when you think of how critical the joint is. But if you disturb that blood flow, then the head of the femur, the ball of the ball socket just turns it just disintegrates.
It just dies and becomes brittle and goodbye.
He played baseball with a.
I can't imagine.
20 years ago, 25 or 30 years ago, he played baseball with a hip replacement. After his hip, he couldn't. He didn't let him play football. He played He played outfield.
Yeah, well, it's probably worth it making all that money, and then you can just sit around and retire and drink your cocktails on the beach when you're a gazillionaire, right?
Yes.
So infections can occur, obviously, and then everybody knows about inflammatory arthritis, such as rheumatoid arthritis that destroys joints. And then old age, osteoarthritis, things start to narrow down. So, but anyway, there's a lot of reasons for young people to have their hips fail on them. And so, like we said years ago, the technology was such that a hip replacement would only usually last 10 to 15 years. And they would just get weak with time. And you could try to do a revision or a second one, but there's so many complications, infection, just not being the same, not being able to walk properly, really limited. And so they would give you kind of a one chance. It would be make sure that when you get this, that it's going to possibly last the rest of your lifetime because we don't want to do it again. So you kind of had to guess how long you're going to live and put it off as long as possible, which rendered so many people with so much pain for many years of their young life. So you're not out there doing the fun things you want to do in your 50s, 60s, your go get 'em years, retirement years. You're kind of just waiting around.
Yeah, I know a guy with probably 10 to 15,000 skydives on a replaced hip.
Wow.
Mm-hmm. Yep. Massive trauma when he was younger, which destroyed his hip. And then they're like, and he was very young when he got the hip replacement. And he's just like, yeah, I mean, dude, so do whatever I want.
I was looking back because I didn't know the whole history of hip replacements, but just a real quick overview. So they started doing them in I think it was the late 1800s. Someone attempted to do them. I'm thinking wartime stuff.
With what, like horsehair?
Horsehair? No.
I mean, they weren't even washing their freaking hands between like doing autopsies and surgery. So I'm sure I'm sure the chances of success were really good.
They used,
would they use porcelain or something?
They used some kind of cement, and I think it was wood.
Oh yeah, nothing could possibly go wrong with that.
So they fashioned that thing, and then of course that didn't go so well. The next thing, the second type of artificial joint was glass, which, as you can imagine, one fall down, go boom, glass shatters, there goes hip. Yeah, so that then spurred them on into the early 1900s to look for better technology, and that's when they started coming up with different metals and alloys, combinations of different types of metal to put together and put in there, which is what lasted for a long time. And then cement, a type of cement that they poured into the bone.
Can you smell it? I can still smell it from 30 years ago when we did cemented joints.
I can, yes.
Yeah. And it's wild. That stuff hardens so quickly. The catalyst in it gets so hot when you mix it. And they'd have leftover bone cement. You just make it into a ball, and it's like a billiard ball. It's so hard.
And you had limited time to work with that stuff too, is it?
Yeah, or else you got to go in there and scoop all the crap out, which is brutal. So then they came up with something that was really ingenious.
Yeah, so not actually.
Actually really ingenious.
I was reading through when they started to come up with a better idea of something that would be a little bit easier to work with. Some people were actually having reactions to the metal in their bodies too, because the metal from those joints actually leaches into your bloodstream. Believe it or not, you could do urine tests and detect small amounts of, trying to remember the alloys of metal.
Is that cobalt?
Yeah, cobalt was one of them. But crazy reactions would start occurring in some people for sure. If you had nickel allergies, it could be an issue. So then some genius doctor decided to come up with the titanium hip, which is pretty much where we're at now. The titanium implant is wonderful because it's actually bends a little bit. So it gives you a little bit of give compared to some of those really tough, strong metal steels. You want it to kind of move your body slightly, but it also apparently stimulates bone to grow into it. So when the bone is healing, it sticks to that titanium and becomes part of the titanium and makes it stronger.
Well, and then it actually has like micropores that when they build the hip, it's obviously etched in some sort of CNC laser etching machine so that the bone actually grows into the titanium.
Correct.
So cementless hips now are the standard, and they are way stronger than the cemented hips, which is fascinating because now you ask an orthopedic surgeon that does these, and it's fairly specialized. Most people that do joint replacements do just joint replacements, or some will do hips and knees. It's getting to the point, especially in a lot of bigger urban areas where you just do one. You become an expert in hip replacement or knee replacement or shoulder replacement, or there's now small joint replacement where they'll do joints of the hand. Which is actually really fascinating, because there's a saddle joint in your thumb that can get really arthritic, and it's very disabling because you basically lose function, like any pain-free function of your thumb. You replace that and people are just like, I have a hand again. I can, do manual tasks. It's pretty wild.
Yeah.
But they don't know how long they last anymore because they don't wear out.
Well, that's
unless you're crazy and do crazy stuff with them, where like you fall down immediately post-op.
Right.
You start doing super intense activities that pound it, because it's not that they really wear out. The problem is they get loose. So if the femoral component or the acetabular, the pelvic component, get loose, then you have a problem.
Right. And so they recommend, and you'll hear different things across the board from people who have hip replacements, but pretty much the standard is that obviously with these titanium ones, they think at this point they have great data lasting 20 years, even up to 30, and they don't even know longer. So obviously anything that's going to weaken it or wiggle it around in that leg bone, the femur where the post is going to make it looser and wear out. So obviously we'll talk to, things that give you a better outcome, but keeping your weight down and not putting more weight on it is going to help. Obviously, it's just biomechanics and physics. So weight loss, not getting obese, but impact being high impact sports or hard repetitive things, as in running. And so some people do run after hip replacement. Most orthopedic surgeons don't recommend it because, as mine told me, you put 8 times your body weight through the hip joint itself when you run for that amount of time, and it's cushioning that. So if you do 8 times your body weight of that force going through that bone, that's a lot of force over time. And so, yeah, you might be able to run on the thing and do your triathlons and Ironmans that I've heard people do, but it's not going to last. The data for lasting past 5 years is not too bad, but 10 years, forget it. They'll be getting a revision. And at that point, maybe the technology would be better. But honestly, if you want the thing to last, you shouldn't be running on it. So low impact things are fine. You want to avoid any high impact stuff, like unless you're a high paid football player, and I wouldn't be going out and doing weekend warrior football tackle games or anything like that either. So that's the main things.
But most stuff you can do, like you can ski, as long as you're not doing a bunch of jumping or something.
Correct. But jumping and landing. So running is the big thing, putting a lot of weight through it. So anything that involves that, most people give up. I guess
cycling,
jump rope would be
thing. No problem.
Yeah, exactly. Pretty much everything else. The other thing that used to happen is they've also changed the way that the approaches, and there's different kinds. You'll hear people talk about, well, my doctor does an anterior from the front, mine does it from the side, mine's kind of side to back, lateral. And there's different ways and techniques that they can open up the muscles and reveal the hip joint and put that in there with minimal amounts of cutting of the muscles, faster recovery. But also what they've perfected now at this point in time is what commonly happened when we were in medical school is you could dislocate the hip, and people think of knees dislocating, or especially shoulders. Well, you do not want that to happen with your hip. That's a big problem, as it weakens the muscles around it that hold it together. And so that was a common thing. There were certain movements you used to not be able to do. Bending over and rotating your foot in, etc., would dislocate.
Well, there
hip.
Goes the weekend.
And I remember, pole dancing and crazy yoga and such. But I do remember when we were in med school and residency, a few of those coming in from people who had it was usually elderly people that slipped and fell, but got themselves into an awkward, I think of a newborn giraffe position and dislocated those hip replacements. Not cool. So anyway, how can you avoid getting a hip replacement though? There's other options and there's different things. So instead
of absolutely no activity.
Yeah, there you go. I don't know. I think that's a setup for a full hip replacement. Absolutely no activity. Couch potato.
Absolutely no activity.
Well,
have a power chair that drives you everywhere, like on WALL-E.
There you go. I'm
Yeah,
thinking pressure sores are going to be your main
no,
problem.
that's true.
Ulcers. But obviously, most doctors going to recommend that if you are overweight, reduce your weight so it takes a lot of impact off your joints, keeping it mobile. There's a lot of things you can do, even if you're having pain or you've got some arthritis in that hip. There's some therapy injections that they'll try. I know some people have done steroid injections in their hip to decrease the swelling. You have to be really careful with that because the more steroids you put into a joint, sometimes it can start to destroy the bone and make the osteoporosis accelerate faster and also damage the healthy bone that you want to attach the implant to. So that's a guarded thing as far as that. They can do other things artificial. I think they're using that Synvisc and artificial injections with PRP, but I think those are better for tendons. So you can buy some time with some anti-inflammatories and changing your activities and physical therapy. Then there are some people that can get away with a thing called hip resurfacing. So that's not a complete hip replacement. But the first time I went in for my hip, my doctor talked to me about it. He said I wasn't a good candidate because, number one, I'm a female and they don't, for some reason, well, the reason is anatomical and they don't work as well in women because of the shape of their pelvis and the geometry and biomechanics.
Yeah, but you just tell your pelvis to identify as a male pelvis.
There you go.
And then it completely changes the biomechanics of your pelvis by magic unicorn farts.
Perfect. Yeah, that's what I should have done. But, that wasn't the in thing back then. So females, age, people usually over 50 can't.
I'm sorry, it's called
those as well.
People assigned female at birth.
You're so distracting me, and I can't think.
I know. But my very presence is distracting.
But commonly males that are usually high-end athletes, ages 30, 40, usually athletic injuries, what they'll do is they actually put in just the ball portion at the top of the femur and the cap on it, and then it's a temporary fix. It allows them usually to get back. And Andy Murray,
yes,
who's a professional tennis player, just had that done, so he can get back to playing professional tennis and make some more money. And then he'll probably need a full hip replacement.
Right, but you could probably pound the piss out of it, and it won't matter because you don't have a component shoved into your femur.
That's the benefit.
That's the key, right?
It's correct. They can run, and actually, I saw the data on it compared to people with full hip replacements. These people with the revision. They have like 75, 85 resurfacing have 85% success rate with like running at 10 years. There's no damage to it. It's pretty crazy.
Yeah. And that would be a really specific thing. Like I would assume that virtually 100% of those people are injuries. Like they get a labral tear or something usually, that starts to jack the surface up.
Usually it's a torn cartilage in there that does it.
No, it's like my knees. My knees are my articular surfaces of my knees. So my femur and my tibia are pristine. My menisci are largely not really there, but that's okay. Because I'm old enough that hopefully when I time my knees out entirely, that I probably won't care about the stuff that I like doing. So, or it'll be different stuff that I like doing. Can you bring the martini?
You'll be an aqua size.
Can you bring the martini shaker? And I gotta watch Jeopardy 400 times a day. So
what's different than now?
Yeah, right. Well, just I only watch 300. So
and then there's the partial hip replacement, and then there's partial hip replacement.
Partial joint replacement is really awesome.
Where they literally kind of do half of it and keep all the healthy stuff in there. I mean, the more healthy bone you can preserve, the better.
No, that stuff, especially in knees, is really crazy because it used to be if you're going to get a knee replacement, they're going to do everything. Now it's like, okay, if you have the, medial side, the inside of your knee is all jacked up, they just give you that. If, in my case, my kneecaps are trashed. Every other part of my knee is fine. And I've talked to my surgeon about it. And he goes, yeah, I wouldn't do anything now because you can still do a lot and it's not that bad. He goes, when you can't stand it, let me know and I'll give you kneecaps. And he goes, you can do whatever you want to on kneecaps because they don't load. I mean, they don't load anything. He goes, you can run as much as you want. You can,
right.
And I'm like, sign me up.
Unless you're on your knees begging all the time.
So you can't be Catholic.
No. There you go. But yeah, that's kind of the history of sort of what causes a person to need them. It's not just for the old. As technology has improved, you're seeing more and more young people getting them. People want quality of life. I got to the point where with the first one, well, even this time, walking to the mailbox a quarter of a mile was painful, but I would go out for a walk with you. I walked 2 miles and I could just feel it. And some days were bad and some not so bad. But then I was like immobilized for days and the pain was excruciating. And I was almost at the point where I couldn't put my sock on.
Well, you're at that point right
and
now.
I'm there, definitely there now, post-op. But so if the limitations are affecting you that much and your quality of life and you're young, then hey, do something about it. Because I wasn't going to wait till I was 70 and just sit around on my butt. So,
well, no, and I think that's really the key. The key is to retain as much activity as you can for the longest period of time.
correct.
So
That's
you
weighing the risks and benefits.
Well, right.
etc.
So let's say it lasts 25 years. Okay. Well, and you needed a revision just to, walk around and not exercise. Well, it's 25 years from, your first joint. It's 25 years later. So, two things. One, you're not going to care about it as being as active as you are now. Unlikely.
Correct.
And the technology is going to have changed significantly. Unless, of course, we believe all of the BS about the World Economic Forum, in which case it won't matter because we'll just be heads in jars.
Yeah, but
and consuming the least amount of calories as possible as useless eaters. But yes, assuming that doesn't happen, the technology will be at a place where revisions may not matter. I mean, we at that point you might have nanobots that you inhale and they go and they just reconstruct the bone.
Exactly.
They just morph it into something else.
Well, and it's amazing how far technology's come already since my surgery 6.5 years ago. I mean, they were doing robotics then, but mine was just a standard replacement. This time it was the Mako robotic assisted arm with all the
like Better Call Mako for a $75 paint job.
Different spelling.
Okay, good.
But
if you don't prep your car right and prep it yourself, you can get a decent paint. Somebody at Mako knows how to spray paint, but if they don't know how to prep jack.
Yeah, so it's crazy how just technology changes even in this short amount of time, even what the differences, which I'll get to, and how they had me up and walking, fully weight bearing this time, and medication. So who knows what will happen, right? In 25, 30 years.
Yeah, I mean, fully weight bearing in essentially 3 hours.
Yeah. So what happened in 2016 for me and my experience then was, which is common for a lot of people, I had no symptoms of anything. I was running half marathons and preparing for this race. And one day I was at the gym doing a workout and thought, my ass cheek really hurts. I think I strained it, just like I thought I pulled something, and kept working out and doing things. And actually,
you can pull my ass cheek.
Pull your own.
That's
pull
fine.
Your own. Let's just leave it at that. So when I ran, I didn't have pain. It was afterwards in my butt. And then it would radiate to the groin. And I just I have a lot of issues with tendons anyway. So I chalked it up to that. And without going into a ton of detail of how things evolved, I kept racing and running, because when I was out there running 10, 12 miles, it really didn't hurt till after. Then it got to the point where it was getting bad and started to giving me pain and catching. And I'm like, this is acting like a torn cartilage, because I've had it before in my knees. Time to see somebody about this. So I was thinking maybe I just had a torn cartilage or a labral tear in my hip, and went to one of 2 orthopedic docs at the time in our state that did arthroscopies. And he was thinking, from the x-rays, there's some mild arthritis, but sometimes you can't always tell from the x-ray how bad things are, believe it or not. And I was young, so he said, it's probably a tear of the cartilage in there. Let's do an arthroscopy and see how things are. We'll clean it up and yada, yada. Well, that was in, I think, March or April. Can't remember exactly. So I had my arthroscopy of my hip, and lo and behold, came out of there, was on crutches, and usually you're off of those in a couple of weeks. So I had trouble getting off the crutches because it was still so painful. And he told me after the arthroscopy, wow, what a surprise when I got in there, how bad of arthritis you have in that joint. It doesn't look like you will make it past 12 months without a hip replacement, which was a real surprise, a devastating, thing to hear, because like, who would have thunk, right? I was all of a sudden doing great, and then boom, someone tells you, no, you just have severe arthritis, you're going to need a joint replacement. So that was really hard. But of course, what did I do? If you're in pure fine fashion, I thought, well, since this baby's going downhill, I might as well keep having fun on it, and let's keep running as long as I can. So what we did a race that fall, wasn't it?
Oh, the Vegas. I think that was the Vegas half marathon.
Or was that before my arthroscopy? Everything's
I don't
blurring
know.
together.
That was a
But
really
anyway,
horrible race.
Your knee was hurting. My hip was hurting. It was dumb. But I pretty much wore it out completely. And then was going to try to actually chill and make it last as long as possible. But it was impossible. Even just, I couldn't walk around, do shifts at work. Couldn't go for walks. Got to the point where then I pretty much used that crutch and cane continuously. Getting up and out of the chair hurt. I wasn't sleeping because it's painful at night, despite, downing bottles of ibuprofen and so forth. So I threw up my hands and I said, I can't live like this. I'm ready. So I got in really quickly for my surgery. And then at the time, it was just standard hip replacement with no robotic assistance. And the standard at that time, which I don't know, it probably varies between surgeons still, but I was placed on, after my surgery, blood thinners for a month, which really freaked me out more than the hip surgery, because as doctors, we all know the dangers of being on those crazy blood thinners. I was on Lovenox, and all I could think of was when we were driving home from the surgery, I didn't worry. I said, don't get in an accident, because I was so scared of dying from like a head trauma and bleeding out of my brain and my hip recovering. So that was frightening. And I think I only stayed on those for 2 weeks because I was doing so well. And I just said, look, I'm more scared of slipping and falling and dying in a car accident. But I had to do blood thinners then, which that's changed. The other thing is, when I got up and was on my walker, they only really allowed me to put 50% of my weight on that thing for the first 2 weeks. So it was hard getting in and out of the shower. I'm kind of balancing precariously, needing a lot of assistance. And so this time that's changed as well. So the whole thing was also tainted by the fact that my procedure, when most of these are done as day surgeries on people who are young and healthy, that means you go in early in the morning, they put you to sleep, do the procedure, then they give you a little PT session in the hospital or the surgery center, wherever you're at, to make sure you know how to mobilize, get into the bathroom, up and down your stairs, and they send you home. Well, I had a bad outcome with anesthesia, let's just say, and proceeded to be admitted to hospital overnight because they couldn't stop me from vomiting. And the anesthesia that you get really is a big, important part of your surgery too, as far as getting out of there, because everybody reacts to anesthesia differently. And they pumped me full of all kinds of narcotics while I was asleep for pain management, and that didn't go so well. So that delayed me from getting home. But all in all, that time, I did really well. And at the 2-3 week mark, I went to physical therapy because that was the thing to do, even though I was an athlete, and it was really helpful. Taught me how to get around. And then I think by the time it was 3 weeks, I was driving, and by 6-8 weeks, I was pretty much without a cane. But I didn't go back to work until 12 weeks post-op because doing 12-hour shifts was just not amenable to walking that much. But most people can get back to work at about 6 weeks, 8 weeks, depending on how much standing you do. So this time, what was really pretty cool and different was I wasn't in a hospital. I was an outpatient surgery center. And people are going to ask. So I always tell them my surgeon, Dr. Mark Wagner, who's in Tigard, as part of a surgery center, Oregon Surgical Institute. That's an outpatient setting, much nicer than hospital because it's privately owned and run by usually a group of surgeons who can pick their staff, and they treat you like a king or queen while you're there. It's really top rate, top notch. It's awesome.
Absolutely outstanding.
And pretty much this time I was like, please, no narcotics of any kind. So for pain control, and people can't believe it.
So it was amazing. The service was so good. May said that she wants no narcotics, and I said, well, I'll take hers.
Yeah. And imagine that.
I got to wait around
on a
here.
platter. So I posted that before surgery when they're getting you ready, and there's a process. They do give you medication ahead of time. So I did take something called Celebrex, which is an anti-inflammatory, and a bunch of Tylenol orally. And then that was it. They gave me in, they wheeled me in, and they did not waste time. I had that IV in, and they put in the propofol and gave me a little bit of it so that I was kind of 2 cocktails to the wind, but not asleep. I sat up, and they gave me an epidural.
No, they gave
Sorry,
you
a spinal. They gave me a spinal. My bad. Which is an injection in my back to numb my legs to give me pain control. So it's a nerve block. Basically, that was the pain control. And next thing I know, my legs weren't dead yet, but I'm on my back and I'm asleep.
And the surgery was what, like an hour and 15 minutes or
Yeah.
an hour and 20. I mean, it was pretty
So when I woke up,
fast.
my feet were just still tingling and I couldn't feel anything, but that wore off really pretty quickly. The surgical leg stayed numb for a good long time, up to, it wore off enough, obviously, I could walk around there, but it gave me enough pain control in my butt for 24 hours that it wasn't really hurting. So as that wears off and you come awake, it really felt like I was waking up from a colonoscopy. I wasn't sick. I felt great. They fed me some great lunch. And then when I was able to stand, I went for a little walk down to the bathroom, showed them that I could do stairs. And I was full weight bearing on my own. And it was crazy. The other thing I want to say that I noticed immediately when I stood up is what can happen. And I was going to get to like complications and stuff with this, is that you can get a leg length discrepancy or irregularity after a hip replacement because they do their best to make it fit exactly anatomically, but it's always going to be a couple millimeters longer, right? Because you have these parts going in there, extending things. So I had about 3 millimeter difference on my left hip, my previous surgery. So it was a little longer. And I always noticed that when I was working out and walking, and some things that would bug me, and certainly on my Peloton and riding, right? I would affect my gait and my tracking riding. But as soon as I stood up this time, because he checked before, I said, yeah, the left leg you did is a little bit longer than I like. He's like, okay, yeah, we could get that closer. I stood up and I could tell the difference right away that they were pretty much almost dead even. It's crazy.
So if I got this done, could they give me like 4.5 to 6 inches more height?
They could. Yeah. There you go.
They just like lengthen, like kind of like stilty.
Stilt hips. They're good. So anyway, that was the biggest things. And so now that I'm home, what I notice a lot different from last time, that's nice, is that my gait I've been recovering so much quicker because I can fully weight bear. I've got my walker just for steadiness, but I can walk well without it. Obviously, my ass cheek, my glute is really swollen and sore. I'm only taking aspirin, 81 milligrams twice a day. That'll do that for 6 weeks. And the painkillers they gave me, I got off of those as quick as possible just because I get horrible side effects. I don't like how I feel, but I get constipated so bad. It becomes a bigger problem than the hip pain. So just using acetaminophen and Aleve is what I do. And then the big risks, so I want to say long-term that they worry about obviously is clotting, because when you have a big surgery like a hip replacement, a knee replacement, clotting in your legs is an issue. So they really encourage you to be mobile and moving and exercises to keep from having a blood clot. They don't like you to fly or travel long distances in the car. Like we had an hour and a half drive home And they suggest that you get up and move every hour. And so we did. We stopped on the way home at a truck stop, and I got out at an hour just to walk around, mostly because it felt better on my leg and my hip because it was seizing up, but also just to reduce clotting. And you can wear your athletic support socks. They don't put you in those horrible support socks like they did the first time I had my hip replacement, which is pretty cool.
I like the fact that they have like a little grease nipple on the side, though.
Tim was trying to pull on my athletic socks, those compression socks, and I had a hard enough time getting my sock on my foot, let alone trying to pull. It's hard to get those athletic compression socks on yourself when someone else is trying to do it for you. It's just,
That's why you can't dress a dead body.
No, it's so bad. So those are concerns. Obviously, the three, I think, big no-nos, like orthopedists say, is don't fall. You just don't want to fall after a knee or a hip replacement right away. I mean, that's just the big uncool thing because it's going to dislodge it before it's healed. Being cautious with your physical therapy and not overdoing it or underdoing it and not dislocating things. That's the big things.
Yeah, and the big complication that everyone freaks out is an infection. If you get an infection in an artificial joint, there's no blood flow there, so it's
that's
pretty
the other
devastating.
Thing.
So
I don't get to take the bandages off till 1 week after, so you got to be careful about keeping the water off of there and keeping it covered. The other thing to prevent infection that must occur all the time, because they preached this the last time and they preached it again, is no pets sleeping on or near your wound for the first 2 weeks for sure. Maybe it's a month, but 2 weeks. And so, people saw it. The cat's laying on top of me on my blanket. I'm like, what the heck? What are people doing? And apparently it's been reported so many times that it's a problem that people wake up with their, commonly dog, licking their surgical site, because I guess dogs like to lick wounds to help them heal. And so
they help when
pets.
Dogs lick their own wounds. It actually does speed dog wound healing.
Now, I don't know what cats too must do it, but it just sounds disgusting to me. So yes, that's a problem. Pets licking their wounds.
It's just like, common sense is just dead.
So
you just had a $50,000 surgery. Hey, let Fido lick the wound.
Let this little boxer bite
like,
my
what?
stereo strips off. Go ahead and rip them off with your teeth. So great.
It's just beyond comprehension to even try to understand that. It's just like,
anyway, every time they say that, I just shake. I'm like, what? But of course, pets can get under, they're running around. If you got a big lab or a Doberman, they can take you out really quickly too, as you're hobbling around if you're not that mobile. So you have to be careful. But that licking I was just like, that's sick. And ice, people underestimate how awesome ice is. I ice this sucker like every hour and a half.
But the question is whether ice actually makes it heal faster or if it just makes it feel better.
Well, so it almost doesn't make it feel better. Here's the little trick, or not trick. Here's a little inside information. When you have a metal joint in your body, it chills very quickly, more than your skin does. So when I put that ice pack on, it will feel like it's the temperature of, I don't know, Neptune or the coldest place in the universe. My leg throbs, like that feeling where, you put cold metal next to your skin, like it hurts so bad. And then I touch my skin with my hand and I'm like, my skin's barely cold. So the metal implant chills way quicker. It is the most weird thing. So you can't ice it that long and it starts to ache. So it gets to the point where I don't know, is it dead? It doesn't deaden the nerves. It's like killing that implant.
Yeah,
but it does reduce swelling for sure.
Yeah, but the question, it's just like treating fevers, right? Like, there has to be a reason that we get fevers. So intuitively, it makes sense that a fever is not a bad thing if you're sick. Or is it a bad thing? Is it a side effect of all these good things that your body does? And this one thing is, and I tell patients, I said, I don't know if we should treat fevers. All I know is if your kid has a temperature of 103 and you get it to 100 or 101, they're going to feel way better. And they have a self-limited illness anyways. So who cares? Feeling good is probably not a bad idea.
Right. There's a reason for fever because it does actually.
But there's also a reason for
And there's
inflammation.
also a reason, exactly. And so with a lot of orthopedic injuries and a lot of post-operative things, a lot of docs won't use anti-inflammatories because they want a little inflammation and swelling because that brings the healing factors there. So it does vary, absolutely. But in my case, nothing better than putting corn syrup in a Ziploc bag and freezing that thing.
No, you put it in 2 Ziploc bags.
Yes,
because if you put it in 1 Ziploc bag, you will have a sticky mess in just a matter of time.
And we have had that.
Yes,
so now,
we've had the rupture of the corn syrup. Yeah. That's not good.
So that was a cool trick I learned last time, was the Caro corn syrup in there, because that stuff doesn't ever get rock hard. And I have the same ice packs from 2016. They last that long. So that's a really cool.
Maybe we can get Ziploc as a sponsor.
Maybe we could. Other than that, I'm trying to think what else, just prehab and rehab is really important. And I think the thing for me that has helped me bounce back a lot is I was fit anyway. I'm not overweight. I'm athletic. I was doing a lot of weightlifting.
But you did a lot of very specific exercises.
And And
that makes a huge difference.
I had strengthened my glutes stronger than they've ever been this past summer because.
Did you use the Brazilian butt lift technique?
Well, some of them I did.
Some of them you did?
Some of them I did.
I mean, there's only so many butt exercises you can do. Let's be honest.
But having, if you're facing something coming up like that, getting yourself in shape ahead of time makes a massive amount of difference. And so there's no point in going, there's no point in doing this because I'm going to have to start all over. It makes a massive difference being strong ahead of time. And just having my left leg be strong to support me, almost be able to do like a one-legged pistol squat to get down and up is huge. So the being in shape before is really helpful. And they recommend they give you exercises that you can start doing ahead of time if you're not already athletic, and then following the directions after, not overdoing it. If you're the type of person that likes to go gung-ho, or you're already, you think you know better, don't overdo it because that can be just as bad and set you back. And then the last thing I would say is it's just important to choose a surgeon, a place, a doctor that you trust, that has a good reputation. That's not their 10th hip replacement or knee replacement.
I think that's the best. I think that's the perfect place to end this, because that's what it all comes down to. Mm-hmm. Like, you can read like surgical studies are notoriously terrible because you can't really blind the study, and the difference between every single case is vastly different. And so who does your procedure is critically important. And, and I talked to one orthopedic surgeon, and he was great. He did tons of knees and hips. Really nice guy. And he would get these university professors that would come in that had read everything about the procedure. And they'd get in arguments about which joint he should use or whatever. And he would just look at them and he would just stop the conversation. He'd go, here's the deal. For 48 weeks a year, this is all I do. I've committed my entire life, my entire adulthood, to being able to replace joints as efficiently and as perfectly as possible. 2 weeks I take off and do education. 2 weeks I go on vacation. So you either trust me or you don't. But we're not going to argue, because I'm in charge of this joint replacement if you choose me. And if not, there's tons of other guys to do it, and there's the door. And I was like, you know what? That is the perfect response.
Oh, yeah, because
that's the kind of guy I'd get, because of like, okay, this guy actually believes in his skills.
Yeah. But it's such a common thing now. You probably can look to your left and look to your right and find someone that's had a joint replacement, that's had a good experience or a bad, get input from friends, doctors, any kind of medical professionals are going to know. They're hip replacements, pretty standard thing. They are much easier to rehab from and come back from than knees.
Knees are really unpleasant. Knees and shoulders. Well, the problem with knees and shoulders is the only way the joint has any integrity is because muscles are attached to it.
Yeah. So
you have to rehab those muscles like crazy. And but yeah, I mean, this is a piece of medicine that is amazing. Like, what this has done for people and their quality of life compared to virtually every other medical innovation since, I would say, maybe 1960. There's been a few cancer therapies that have been revolutionary. Hodgkin's disease treatment, testicular cancer disease treatment. There's not a lot as revolutionary. There's like I said, a few cancer treatments and joint replacement is just staggeringly good. I mean, I'm kind of at a loss to think of anything else that can be so dramatically life enhancing for relatively low cost with regards to the potential complications and recovery.
Right. And then the quality of life difference, that we've seen just from our time in medicine from when
and just from our patients. You get people that they're weeping because they haven't ridden a horse in 25 years and they're hiking and horseback riding in their 70s again, and they hadn't done it. I mean, it really is that's a big deal. Like, if we're going to live in a rich country with these therapies, it's like, man, take advantage of it.
I would say the other thing that makes me think of that is the people that get the cochlear implants that can finally hear. I mean, that's dramatic.
But they don't, it's not the same because they hear, but they don't really hear.
Well, that would make for an interesting
it would be interesting to talk to somebody because there's people that have like the hearing,
or the people that get the glasses that are colorblind, and then they get to see how the rest of the. I mean, that's kind of cool. But as far as impacting your life, joint replacement.
But there is that meme where that little video on social media where the guy could never hear anything ever, and they gave him the implant, and then
you had to tell this,
and then. He the doctor's talking to him and his wife's crying and he's crying and his wife starts talking to him and asking him all these questions. And then he just starts screaming and he's like, you have to shut this thing off.
Shut her up.
It's the worst experience of my entire life.
I want quiet. Basically, he wants his wife to shut up because she's too loud and it's hurting his ears. So
that was
pretty funny.
Was quite funny, actually.
That's a good one. Yes.
So
that's my story. I don't know really how much more to add to that. Those are the common kind of questions I get asked, and if you're looking for more information, just message us. But yeah, really life-changing type stuff. I was hoping to kind of get to this last week when we had Robert on talking about his shoulder replacement.
No, we went down the global psychopath wormhole.
There you go.
Very quickly.
You did.
But it's so much fun. Psychopaths are just delightfully fun, aren't they? All right. Remember, Oregon Valley Farm, no S, for high quality beef, pork, and chicken. We love it. It's worked amazing with the dietary changes that we've made in the last year or so. We can see it and feel it, see it in our bodies and feel it in our level of activity, energy, etc.
Mm-hmm.
There's just nothing like eating food we were made to eat.
Yeah, absolutely. Remember, as I always say, one body for your entire lifetime. So treat it as such. We're trying to last 85 years. That's a long time. So quit putting crap in your body. OregonValleyFarm.com. All right, everybody. We will see you on the socials. And thanks for listening. Share this just with somebody who you think might find it interesting. As always, we like your messages and emails. So give us a shout for any questions. See you next time.
It's no secret that medicine is a bit uptight. That's why Tim and I created BS Free MD to mix things up a little and have fun in the process. Besides, we are having these exact same discussions all the time, so we thought we might as well invite everyone to the party. If you really like us, you can get plenty more and maybe see one of Tim's cool tattoos on our Instagram or Facebook pages at BS Free MD. See you next time.
While we try to keep BS Free MD as raw and real as possible, we can't be held responsible for any medical decisions or discussions had as a result of what you've heard on the show. We know, bummer. But the truth is, we really do care about your questions. So feel free to reach out to us by email at doc@bsfreemd.com.